It's WesTex Wednesday, and Dr. Beck continues to answer our COVID-19 related questions. One hot topic recently has been antibody testing, which WesTex started doing last week. Dr. Beck says many people want to know if they've already had the virus.
One of the things that we're starting to do now, because we've seen a fair amount of people who have had COVID-19, and we've got a lot of people that want to know if they've had it. They might not have been able to get tested because they didn't meet criteria, or they were sick and they didn't want to get tested for one reason or another. They might not have been tested, but they want to know if they're possibly immune to COVID-19. Theoretically, if someone has the presence of antibodies in their system, then they should be immune to COVID-19.
This is the second week WesTex Urgent Care is offering that testing, and Dr. Beck says it's pretty easy to have done.
Now, it is a test that you have to come into the office to get the blood drawn. Blood will be drawn from your arm. The lab that we use will get our results back usually within 1 or 2 days.
And there are many antibody tests on the market right now, and Dr. Beck says some are more reliable than others. WesTex uses a quantitative test to see exactly how many antibodies you have.
The difference between qualitative and quantitative is qualitative test is yes or no. Either yes, you have something, or no, you do not have something. The quantitative test is the test that we're using, and again, it is a blood draw. You have to come to the office to get your blood drawn, but it actually gives you a level of the antibodies in your system if you have them. Now, if you don't have them, it'll say you don't have any antibodies. So it still answers the question yes or no, but it gives you what we call a titer or a level of antibodies in your system. It's a quite accurate test. The sensitivity and the specificity are pretty high. I've been told on the order of 95% accurate.
Another reason to get tested for antibodies is that you could also help save a life.
If you have presence of antibodies, it could potentially allow you to be a donor to donate what we call convalescent serum. It's a matter of, where blood is drawn off and they separate the antibodies in the serum, and they can give that serum or that plasma to people that are very sick with COVID-19. In other words, these are preformed antibodies that can be given to a person who's got COVID-19, and it can help them fight the infection. And that's really reserved mostly for just the sickest of the patients that have COVID-19.
This test is FDA approved and covered by insurance. And if you don't have insurance, Dr. Beck says the test is still pretty affordable. If you're interested, visit WesTexUrgentCare.com or stop by any of their clinics. They have 2 locations in Midland and 1 in Odessa.